Hello, and welcome to our home infusion instruction video. I'll be your guide as we walk through the steps of how to self-administer your infusion therapy. We know this can feel a bit overwhelming, but we will provide a detailed overview so that you'll feel comfortable and confident. As part of your home infusion team, we'll provide a personalized treatment plan to assist you on your road to recovery from the comfort of your own home. Our Care for Who I Am culture reflects our unique care model, which focuses on you as an individual to help improve your life in a meaningful way. Find a clean surface to prepare your TPN. Clean the surface with soap and water and dry it with a paper towel. Take your TPN out of the refrigerator 2 hours prior to administration. Gather your equipment. TPN solution, 1 to 2 10 milliliter syringes, insulin syringe if needed, alcohol wipes, and multivitamin vials. Remove the TPN tubing from the packaging and close the roller clamp. Wash your hands with soap and warm water. Then dry them with a clean towel. On both saline syringes and heparin syringe, remove the plastic wrapping. Take the TPN out of its protective bag. Check it for cloudiness, particles, or a change in color. If lipids or fats have been added to the bag, check for separation of the lipids from the solution. Check the medication label for your name, birthday, correct medication, expiration date. Take off the protective cover from the top of the medication vial. Clean the top of the vial with an alcohol wipe. Repeat this step for all medications that you will add to your TPN bag. Clean the medication port of the TPN bag with an alcohol wipe. This is the port where you will inject the medication. The medication port may be located on the outside or the middle of the TPN bag. Pick up a syringe. Attach a needle to the syringe. Take off the protective cap. While holding the round end of the plunger, pull it back to the dose of the medication that your healthcare provider prescribed. Hold the syringe like a pen. Push the needle of the syringe into the rubber top of the medication vial. Push down on the plunger so the air enters the vial. Carefully turn the vial upside down with the needle still attached. Make sure the medication covers the tip of the needle. Pull back on the plunger to fill the syringe with the prescribed amount of medication. Check to make sure that you have the right amount of medication in the syringe. Put the needle into the medication port of your TPN bag. Inject the medication into the bag. When all of the medication is in the bag, remove the needle from the syringe and discard the needle into your sharps container. Repeat steps until all of your prescribed medications are injected into the TPN bag. Use a new syringe for each type of medication. Store any vials that you will use more than once in your refrigerator until they are empty or expired. Gently rock the TPN bag to mix the medications into the TPN solution. Take the protective covering off the TPN bag spike port. Do not touch the exposed end or let it touch anything. Insert the spike of the tubing into the port of the TPN bag using a twisting motion. Load the tubing according to the pump instructions. Do not connect the tubing to the end of your catheter. Do not touch the exposed end of the tubing. Turn on your infusion pump. On the pump startup screen, it will ask, "Prime tubing?" Select yes. The next screen will say, "Disconnect tubing from patient, open clamps, then press prime." Select prime. Lay the pump metal side down to prime. Priming will complete on its own. After the tubing is primed, select stop priming. The next screen will display the amount of fluid that was primed and will ask if you would like to continue priming. Verify there is no air in the tubing and that the fluid reaches the end of the tubing. If the fluid completely fills the tubing, select No. Set the TPN tubing aside. Remove orange cap from the end of the extension tubing. Scrub the clave with an alcohol wipe for 15 to 30 seconds and allow it to air dry. Remove the cap from the saline syringe. Attach the saline syringe to the clave using a push and clockwise twisting motion. Once it is connected, open the clamp on the extension tubing and PICC line if present. Flush the line with saline using a pulse or a push-pause method. If resistance is met, do not try to force it. Double check that all the clamps are open. If the clamps are open, call your nurse or pharmacist for further instruction. When the entire syringe has been administered, clamp the extension tubing, remove the syringe, and discard it into the trash. Scrub the clave with an alcohol wipe for 15 to 30 seconds and allow it to air dry. Pick up the TPN tubing and remove the cap. Connect the TPN tubing to the end of the clave by using a push and clockwise twisting motion. To start the TPN, open the clamps on the extension tubing and the TPN tubing. The pump screen will ask if you would like to start the pump. Select Yes. Your TPN will now run over the specified amount of time. If you are adding insulin to your TPN, please check your blood glucose 3 times. Once at the beginning of the infusion, 2 hours into the infusion, and 1 hour after the infusion. Your pump will sound an alarm when your infusion is done. Wash your hands with soap and water. Dry with a clean towel. Clamp the TPN tubing and disconnect from the clave. Pick up the next alcohol wipe and scrub the clave for 15 to 30 seconds and allow it to air dry. Remove the cap from the saline syringe. Attach the saline syringe to the clave by using a push and clockwise twisting motion. Unclamp the tubing and flush the line with saline using a pulse or a push-pause method. When the entire syringe has been administered, clamp the tubing and remove the syringe and discard into the trash. Be mindful not to touch the clave. Pick up the next alcohol wipe and scrub the clave for 15 to 30 seconds and allow to air dry. Remove the cap from the heparin syringe. Attach the heparin syringe to the clave by using a push and clockwise twisting motion. Unclamp the tubing and flush the line with heparin using a pulse or a push-pause method. When the entire syringe has been administered, clamp the tubing and remove the syringe and discard into the trash. Lastly, wipe clean the surface of your work area. Please monitor for signs and symptoms of infection. If you develop a fever, notice redness, warmth, drainage, or swelling around your PICC line, please notify us right away. If you develop wheezing, difficulty breathing, or swelling of your face or tongue, please call 911 or report to the nearest emergency room immediately. If you develop a rash or hives, please contact us right away. IV antibiotics may cause loose stools and stomach discomfort. If you experience this, discuss with your healthcare provider. Please do not soak or submerge your PICC line dressing. We provide a plastic shower sleeve for your convenience. If your PICC line dressing gets very wet or starts to peel away from your skin, please notify your pharmacist or home health nurse as soon as possible. Our pharmacy team will be contacting you weekly to follow up and verify all of the supplies that you may need. Please keep your supplies in one location for easy inventory purposes.